Hello, and welcome to Pharmside Chat with Pitt Pharmacy. I'm your host, Aaron Davidnathan, and I had the pleasure of sitting down with Dr. Martha Ndung'u. We had a fun chat about her work with the Birmingham Clinic, global health initiatives, as well as serving underserved communities. In our conversation, we learned a lot about how Pitt Pharmacy improves health through service. So let's get started. Martha, thanks so much for being here with us.
I'm so happy to be here.
No, absolutely. You do a lot for the school, but I want to focus on your work with the Birmingham Clinic. I know the School of Pharmacy has a partnership with that. Could you talk about the Birmingham Clinic, how that partnership started, and what was the vision for pharmacy services at the clinic?
Yeah, it started in 1994, which is actually pretty ahead.
Wow.
Yeah, right. It's pretty ahead of times. So the UPMC Internal Medicine and the Pitt Pharmacy School decided to make the program for the healthcare to underserved populations. And from there, they just had the vision of creating something for medically vulnerable populations, some sort of resource, a free clinic where folks could get care, get medications, get the education that they need to live a healthier life. And so we just celebrated our 30th anniversary last year.
Oh, wow.
Yeah.
Congratulations.
Yeah.
You mentioned about the medically underserved population. Could you talk a little bit more about that and what are some of the unique services that the clinic offers?
Yeah, so our population is pretty interesting. It's grown obviously over 30 years. What they envisioned in the beginning was more geared towards unhoused populations, and that has expanded over time as Pittsburgh has changed its population to immigrants and refugees. So we've really expanded our population base in terms of who we're serving, and so that has changed the services that we've given over time. So before it was more housing stability, food, security. And now it's more so a lot of other social services. So even just navigating, getting insurance, hopefully, if you can, but getting other resources for your family from funds for, again, food insecurity is still a big issue now. But we expand past other services. So whether you might need to have help moving, or we've expanded to increasing OT and PT services,
Wow.
vision, audiology. We have now 22 specialties that volunteer through the clinic as well. So ranging from cardiology, neurology, dermatology, all the way to having our pediatric van stopped every Saturday, or one Saturday a month now, outside of the clinic. So we've really expanded what our population base has been and tried to serve them as time has changed.
Okay, so it seems that based on that expansion, there's clearly unique ambulatory care challenges. How do residents and students get involved with addressing these unique challenges you just mentioned?
Yeah, you're right. It's a lot. I think a lot of the times when students and residents come to us, they're used to the textbook
Right.
answers, right? Well, I'll give them this $10,000 drug and that should solve it, just like the guidelines say. So a lot of what the challenge is for students and residents is to wrap their head around how do we address the care that we can give versus what's actually feasible, and meeting the patient where they're at as well.
Right.
So starting from basics and saying what is out there that we can use, and what will actually make sense for the setting. And so that is a huge concept for students to wrap their heads around, that they can't just throw the book at this situation every single time.
Right, and I think that makes it much more practical, especially more real world application.
Yes.
Is there a specific example or an intervention that was made by pharmacy, either by yourself, a student, or a resident with you, that positively impacted the health of a patient?
So a lot of our programs are actually student built. So a lot of the times it's students who really made all of our changes and services.
Yeah.
And one of our significant changes that a student brought up was the use of continuous glucose monitoring. And as we know, those are hundreds of dollars. It costs patients a lot, even when they have insurance.
Right.
And so the student found a resource that we could get free CGMs, and try to put together a protocol. And it worked really well in terms of trying for one-time use of CGMs in patients so that we could guide more education and gaps and fill those health literacy gaps through a CGM. And so that has changed the lives of, we had about 40 patients enrolled in that trial, or qualitative improvement. And so it lowered A1Cs by over 1% in most patients.
Wow.
And we're still seeing those results a year and a half after that trial. And so
Wow.
I won't name names because of HIPAA, but it's been really successful, and we still continue it. And we've actually expanded it to our sister clinics throughout Pittsburgh too.
Oh, wow.
Yeah.
So in that vein, you take students on rotations with you during their fourth year rotations. Could you talk about what are some of the competencies that you develop for students? Because I would imagine that this would be a pretty unique rotation that they probably don't see elsewhere.
Yes, very unique. It's actually really exciting because we get also students abroad and different schools who come for this rotation. And so their day-to-day looks very different every day compared to maybe a regular ambulatory care practice. And so with Birmingham, they're helping with navigating patient education. Obviously, the first 2 weeks tends to be a lot of clinical skills, a lot of patient education skills. But really, my main goal for them to learn is not just interprofessional collaboration, because we have a lot of medical residents and other teams joining us, but it's patient collaboration is
Right.
really my main thing for them to learn and understand in a different way than probably picking up and calling a patient. We are talking to the patient for hours at a time. And a lot of students get really excited because they can actually see their outcomes in those 5 weeks by following through with these patients that time period. And so that is my main objective. Learn just the basics of understanding that it's a patient collaboration when it comes to medications and what they can actually do.
Yeah.
It builds their identity as a pharmacist a lot too, because they learn for the first time often that they can make a difference from not just filling a prescription, but everything else that comes with that.
And I think that's important because they want to feel, and I think we all do, want to feel that we are making a difference. So you talked about students who are on rotation with you during their fourth year. But let's say it's a first year, second year, third year student who may have an interest in potentially pursuing this line of work, maybe want to be the next you. How do you mentor those more junior pharmacy students throughout the curriculum?
Yeah, so for the broader class, they do have to spend some hours, what we call underserved or patient forward hours, across one of our free clinics through our Grace Lamson program, which basically houses all of the different free clinics that we help throughout the city.
Right.
And so they're able to take those hours in their second and third years. We have them currently during the summer, and they usually come back for more if they're really interested.
Yeah.
We also have a global health area of concentration that students can kind of focus and hone in on global health, which in this situation, it is global health, right? Our vulnerable populations here in Pittsburgh. And so they will take electives that place them at different sites, Birmingham being a popular site for those students as well. So, as a student who went through the global health ARCO, who saw my mentors in these positions and now work in this position, we have a lot of wonderful students who their interests are really molded from that first day when they get on campus.
Wow. Okay, so you direct the area of concentration for global health. You also take students on rotations, you mentor students throughout, of course, but then you're also a PGY2 program director. So you wear a lot of different
Lots of hats.
Could you talk a little bit about that PGY2 program and what you may expect from those PGY2 residents that are incoming versus students?
Yes. Expect a lot. So, PGY2, you've already done all your basics of the PGY1. You know you want to do ambulatory care. And often with our program, because it has a global health aspect to it, it's very niche.
Right.
And so I expect a lot of desire to be in this community type of based care. And I expect that, they want to meet patients where they're at and hone in on those skills. So often what the residency program entails is learning transferable skills. They're stationed at about 8 different sites that all look completely different.
Yeah.
And so learning how to do ambulatory care in a setting that, is traditional versus is a small little pharmacy dispensary room where it fits one person versus working in an unhoused shelter and in different places and locations. So the residents learn a lot of transferable skills throughout all the different sites that they're at. And so learning how to be adaptable and flexible, but also learning how to apply their new skills in these different settings every time. And seeing how they can move protocols and change things throughout these different locations.
Wow, okay.
Yeah.
It's a pretty busy year then.
It is, plus 2 international trips. So we got to fit it all in less than 12 months.
So having worked with you, I know how passionate and dedicated you are. When you reflect on all the work that you've done with Birmingham Clinic, what's been the most rewarding moment or even moments that have been for you?
That's a hard question. I would say every day is rewarding. I think, seeing the students connect with that patient and see themselves and see themselves grow through a patient is really beautiful. The other flip side is I'm in this because of patients, right? I love talking to patients and being with patients and seeing how we can make their lives easier. And when that happens, that's really rewarding, especially when the both of them combine, when a patient comes in and goes, hey, where's that student I saw last week? I want to talk to them. Or they call about a resident who graduated 2 years ago. And you can see that connection has been made and that trust has been built. And ultimately, that's what Birmingham does, is we're building trust in the community between the patients and our providers. And that's really key in this environment. Wow. So every day is rewarding. I don't have a pinpoint of this day, this interaction. I think there's a lot of really small wins throughout the day, throughout the week, throughout the year that really help me love what I do and teach that to other students and residents.
Wow, that's great. Yeah. It's really important work.
Yeah, I'm lucky to have all these hats.
What could have said it better myself? Thank you, Martha, for being here with us. Really appreciate it.
Thank you. Thanks for having me.
Absolutely. And thank you all for joining us for this chat with Dr. Martha Ndung'u. We hope you found it insightful to learn about the school and how we reimagine equitable delivery of healthcare by pharmacists. If you enjoyed this conversation and want to see more, please like and subscribe, as well as follow our social media platforms so you won't miss out on how Pitt Pharmacy improves the health and well-being around us. Until next time, thanks for watching and hail to Pitt.